to understand what chronic pelvic pain is, we can go to the EAU guidelines on chronic pelvic pain. It's an excellent document. It's really in deep going to the terminology, the classification, the definitions of men with chronic pain, but also of women. And the definition is that it's something that is persistent, chronic, persistent, and that it is perceived from structures in the pelvic area. This pain is associated with negative cognitive, behavioral, sexual, emotional consequences. It means that it's a multidisciplinary area to approach, definitively. And the guidelines show very well that chronic pelvic pain could be defined as persistent in men and women more than 6 months. When we have a known pathology such as infection or cancer, we are speaking of a specific disease-associated pelvic pain. But we can also have an unexplained situation. And in the unexplained situation, we have chronic pelvic pain syndrome that classically is shortened up to CPPS. But it's also often in our world associated with chronic prostatitis, but it is not only chronic prostatitis. It is depending on the organ from where the pain comes from. We focus, of course, here on the prostate, and the prostate located here in this environment of bladder, of gastrointestinal channel, of nerves, of vascular confusion all around here, And so we have a pain that can be bladder pain syndrome, prostate pain syndrome, scrotal pain syndrome. It could be testicular or epididymal. It could be penile. So we have to differentiate and to locate the men more precisely. And the prostate pain syndrome, PPS, is defined as this persistent or recurrent episode that is in our mind as a patient and a doctor is convincingly related to the prostate. There is a growing evidence that there are initiating factors for an inflammatory and immunological state in the prostate. There's histological chronic inflammation associated with the progression of symptoms, and there is a still very unexplained play with the nerves that we have to do much more research upon. So what are these initiating factors? It could be, of course, bacteria and virus. It could be reflux of urine. It could be obstruction of the infravesical area. It could be vascular deficiency. It could be accumulation of prostate secretion. Sorry? It could be a series of different, and we produce it with the BCG instillation. We produce prostatitis or inflammation of the prostate. So we have a pathway, we have an event, acute, damage of tissue and inflammation, that can go to a chronic stage in approximately 10%. Another group will go for a chronic pelvic pain and prostate pain syndrome that is going under this terminology at the present time, that affects our muscles, our voiding, our neurological pathway, and cause trouble for these poor men. How many are there? There's a lot of studies made in different countries showing some 4, 5 to 9, 10, even more patients suffering of more or less important disorder of the lower urinary area, the pelvic area.